Hello everyone, you're welcome to yet another interesting episode of our video cast. Today we'll be discussing the topic called Introduction to Radiation Therapy. This is based on slides developed and produced by Dr. Nuhu Tumba. He is a consultant clinical oncologist who trained at Ahmadu Bello University Teaching Hospital in Zaria. Let's begin. So the objectives of this topic, which you will see a corresponding handout in the course menu, is to understand the basics of radiation therapy. Basically, what is radiation therapy? We hope that at the end of this, you also understand how it is delivered, different options, and the side effects. And then you would know where, how, and when to refer for radiation therapy within Nigeria. The there are accompanying handouts to follow this, so we'd encourage you to download them and read along because this video is just highlights. Introduction here it says that about more than half of the cancers that you see will at some point in their treatment course require radiation therapy. Now, radiotherapy is a very important cancer treatment modality because it is cost effective and it has lots of benefits to it. Now, breast cancer being one of the most common female cancers, almost always requires radiation therapy. However, not everyone who needs radiation therapy gets it. And the aim of this presentation is to kind of make you a little bit more aware of what radiotherapy does, and so you can potentially advocate for your patients to get radiation therapy. So, what is radiation therapy, you may ask? This is largely, or essentially, the use of ionizing radiation to kill cancer cells or to treat even some benign lesions. And what radiotherapy does is that it breaks the DNA of cells. So if you look in the if you look in the image on your left, you'll find the DNA of this cell here. So this is the DNA we are looking at in the double strand helix. And radiation therapy comes and essentially cuts the DNA in two or something like that and breaks the bond of the DNA so that the cells can no longer replicate. Well, how it does that is very interesting because when it breaks the DNA of cancer cells, it also breaks the DNA of the surrounding tissues which are normal around that area. But the surrounding tissues repair their DNA and that the normal tissues repair the DNA and move on, whereas cancer cells fail to do. And that is how radiation therapy works. So there are lots of slides to explain this in more details. This is just highlight, like I said. Now, in practice, there are three types of radiation therapy. One is external beam, which is the most common one we have in Nigeria and other parts of the world. The other is brachytherapy. So external beam is also called teletherapy, meaning radiation therapy delivered outside of the body and is given at a distance of between 80 to 100 centimeters. The common examples are delivered using radiation linear accelerator or cobalt 60 machine. I'm sure if you think back to your O-level physics, you remember cobalt being mentioned and Marie Curie. Anyway, let's move on. So there is also brachytherapy, which brachy means short, like brachycardia and all that kind of stuff. So it's brachy is short, and it is delivered. It's kind of giving radiation therapy by embedding small seeds into the organ that you want to treat. So, for instance, in prostate cancer, you embed small seeds into the prostate to give a constant dose of radiation. Now, there's a third type, which is the ingested radiation, and in this type, someone takes the radiation isotope by mouth, and it works that way. This is used in treating thyroid cancer. And in the pictures here, you would find two images. The one on the left, which I'm going to mark L, is a linear accelerator, and you can see the bulk, how bulky this machine is. I'm just trying to highlight it here using my marker. It's working today. And then here on the right, you see the other machine called Cobalt 60. The Cobalt 60 is a much older technology, and it's a little bit limited in what it does compared to the linear accelerator. In the next slide, we'll see, we'll go into the details of how they work per se, because there are many slides talking about those details in the handouts. But the main difference is that for Cobalt 60 machine, which is also called telecobalt, you have a radiation source embedded in the machine, and this radiation source is always emitting radiation. Whereas in the linear accelerator, the radiation source is not there. Rather, the machine generates radiation beams, like photon beams, when you turn on electricity, but it uses lots of electricity. And there are many other differences between them, which I'll encourage you to go through. Now, the linear accelerator is a much more a modern machine that tends to do better treatments than the Cobalt 60 machine. But I'd like to emphasize here that there have been some advancements in the or enhancements in the Cobalt 60 technology that make them comparable in their treatment outcomes with some linear accelerators. Okay, so on the third type of radiation therapy, you have brachytherapy. And here in this picture, you can see small seeds. This, I don't know what to compare this with, but these small seeds are like pencil leads, like the lead of the pencil that is inserted into the tumor. And these seeds, if you look at the coin, this is like the US $1 coin, and so it gives you how, or it shows you exactly how the tumor, sorry, how the seeds compare in size with a coin. And so you put this in the tumor, and it delivers high dose radiation for its lifespan, or till the radiation therapist or radiation oncologist removes them. Okay, so let's move on. Why and when do you give radiation therapy? Now, there are different slides talking about this in details, and I'm also just going to go through this quickly. One is radical radiation therapy, which is you give high dose of radiation to cure a cancer, like head and neck cancers, cervical cancers, or prostate cancer. Now, you can also give radiation therapy neoadjuvant, meaning before operation, and this is given to reduce the tumor size and to kind of downstage a disease from, for instance, stage 4 or stage 3 to stage 2 to enable surgery to happen. Now, you can also give it as adjuvant therapy, meaning it's given after the surgery has been done. This is the most common way. This is the most common method of treating breast cancer locally, meaning a woman that might have breast cancer might get chemo and then goes for surgery, and after surgery she gets the radiation therapy. That is adjuvant radiation therapy. Sometimes chemo and radiation are given together, and that is called that is they're combined. For instance, in some cases of colon cancer, some other cancers, you colorectal cancers, you give them together, especially giving radiation with capecitabine, because sometimes the chemotherapy sensitizes the body tissues to the radiation beams. And also, finally, you can give it for palliation, meaning it's given for symptoms control. For instance, if someone has cord compression from metastatic disease in the spine, you can actually give radiation therapy to relieve the compression in the spinal cord. Okay, there are more details about the indications in the handouts. I really encourage you to read them and get familiar with them. So, when a radiation oncologist sees a patient for radiation therapy, you might be wondering, how do they give it? Is it like the answer is that radiation therapy is given in doses, in small slices. So imagine the radiation therapy to be a big loaf of bread here, and now the radiation therapy is given in slices, so in what we call fractions. So that if somebody, if you decided that someone needs 20 can say 1000 fractions, I'm just making stuff up here, okay? So let's say you need 100 fractions, and they give it in 20 fractions every so let's say give 20 fractions per day or something like that, for as long as it's required to make up the number of fractions required to complete that treatment. So you don't give all so they don't give all the treatment at once, but it's broken down into smaller fractions. And most times it's given daily over a short period of time, probably 3 weeks, something like that. Okay, so like any other treatment, radiation therapy has its own side effects, and the side effects might be acute, meaning like happening immediately or within a short time, like by a few days, to chronic. And I encourage you to go through these side effects on the slide. There are also many other side effects identified in the handouts. And we are getting to the end here. Before we go, we'd just like to remind you that radiation therapy is available in Nigeria, although we don't have as many facilities as we'd like or we need. Here in this map, you see which centers in blue have radiation therapy. Unfortunately, Abia State, as you can see here in the map, does not have radiation therapy, and the nearest one to Abia State is in Enugu UNTH. But you might want to know that Marjorie Bash Foundation is working with a number of partners to try to bring a radiation facility to Aba, and that will be called Marjorie Bash Cancer Center. Just keep up with us. We will let you know when that comes to be. Anyway, folks, this is the end of our presentation today, and I'll encourage you to do your pre-test and post-test and get chatting on the groups. Okay, thank you.